Cyclic Vomiting Syndrome. Disclaimer: this video is for informational purposes only. The information and content in this video is not a substitute for professional medical advice, diagnosis, or treatment. For any questions, concerns, or inquiries, see your primary health care physician or a licensed health care provider. Never delay or hesitate to speak with a physician because of data provided in informational documents and videos. What is the cyclic vomiting syndrome? A disorder in which a person experiences repeated attacks of severe nausea, vomiting, and physical exhaustion. The nausea attacks can last from hours to days. During severe nausea attacks, a person may have to stay in bed or even need treatment at an emergency room or hospital. Nausea attacks can reoccur from every few weeks to several months. The disorder can affect the patient for months, years, or a lifetime. The cyclic vomiting syndrome affects the GI tract, mouth, esophagus, stomach, and small intestines. What are the other names for the cyclic vomiting syndrome? The other names for the cyclic vomiting syndrome are abdominal migraine, childhood cyclic vomiting, cyclical vomiting, periodic syndrome, and CVS. What are the causes of the cyclic vomiting syndrome? The cause range from gastrointestinal motility, food movement through digestive system, central nervous system function defect in brain, spinal cord, or nerves that control bodily responses, autonomic nervous system function, defect in nerves that control internal organs, hormone imbalance, and abnormal inherited genes. What are the symptoms of the cyclic vomiting syndrome? The symptoms of the cyclic vomiting syndrome are attempting to vomit, heaving or gagging, lack of appetite, abdominal pain, diarrhea, fever, dizziness, headache, sensitivity to light, and sensitivity to sound. What are the four phases of CVS? 1. Prodrome phase. The person feels an episode of vomiting is about to begin. Symptoms of intense sweating and nausea may occur. 2. Vomiting phase. The person has intense nausea, vomiting, and gagging. They may also have intense abdominal pain. 3. Recovery phase. Vomiting and gagging stops. Nausea decreases. 4. Well phase. All symptoms has subside. This is the quiet period before the next episode. What are the treatments for CVS? Treatments for the cyclic vomiting syndrome are avoidance of triggers, anti-nausea drugs, sedatives, medications that suppress stomach acid, antidepressants, and migraine medications.